When a patient presents with HPV-related head and neck cancer, we have a long discussion as to whether they are a better surgical candidate or a better non-surgical candidate. That treatment decision is really a personalized approach to treatment and is different for every patient and every condition. Once we've decided that route of surgery versus non-surgery, then we can kind of dive into the details of what that approach might look like. The goal is to treat a patient with just enough treatment to resolve their disease, to maximize their survival, but reduce their long-term morbidity and side effects. Surgery is a great way to do that in the right patient. In a patient that's a candidate for surgery, transoral robotic surgery is an excellent way to remove a tonsil tumor or a tumor of the back of the tongue without having to do more extensive surgical approaches. Patients leave the hospital after this surgery 2 days after surgery and typically recover in about 2 to 3 weeks. In contrast to the past, when we used to do very large surgeries that require at least a week in the hospital and even up to a month or more than that to recover. We combine that with removal of the neck lymph nodes that could be implicated, and then use the information we get from removing the tumor with coordination from our pathologist and determine would any additional treatment be necessary. There's some patients that surgery is all they need, and those patients have a very low side effect profile long term. There's some patients that need adjuvant radiation therapy, but we're willing to tailor that to the needs of each individual patient. And when we take a multidisciplinary approach to a patient's condition, we can maximize survival and minimize morbidity and side effects. Other ways we're minimizing side effects from treatment in HPV-related head and neck cancer here at the James is through our clinical trials program. We have a clinical trial open right now that if you're a candidate and we use a lab marker called circulating tumor DNA, if that circulating tumor DNA goes down at a rate that we're satisfied with, then we can actually reduce the amount of treatment you need when you're getting radiation and chemotherapy. That's a great option for patients that are not a surgical candidate, but at the same time, we don't feel like we need to give full treatment because survival rates are so high. Again, we're trying to give just the right amount of therapeutic treatment, whether that's through surgery, radiation, or chemotherapy, with minimizing the amount of long-term side effects a patient might experience.